It's no secret that medications like Ozempic and the other GLP-1s can leave your face looking gaunt, tired, and even aged as a result of the weight loss. But does that mean you need to rush into a facelift? The answer to the question actually may surprise you. I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. All right, so before we get started, make sure if you haven't already to subscribe to the channel and ring the bell. Today, I'm gonna go over everything you need to know and 3 essential safety protocols that are really important to adhere to if you're considering having a facelift following use of GLP-1s or Ozempic. First up, are you actually a candidate for a facelift or in my practice, a vertical restore? So first off, what's the difference between a vertical restore and a facelift? Vertical restore is a trademark procedure that I perform in my practice that is a bit more involved than a traditional facelift or a deep plane facelift. It includes the address of the lateral brow, mid-face, jawline, and neck, and it almost always includes a fat transfer. It's in the deep plane, it's got the durability, but the most important quality is that it looks totally natural. So here's the essence of what's happening. When you are a little bit older, say 40s, late 40s and 50s and above, and you lose weight, the face starts to show signs of aging very quickly. As the subcutaneous fat begins to diminish, the scaffold of the face starts to drop, laxity starts to set in, things become jowly, sagging around the neck, laxity in the mid-face, lateral brow, all these areas start to change the structure and the shape of the face. It's a contribution from both volume loss as well as fascial elongation, which essentially is what aging is. It just seems to become intensified when you have weight loss. Now, unlike when you are younger and you lose weight, the face isn't able to bounce back, as opposed to somebody who's, say, in their 30s, you're not able to get the skin and fascia to retighten over the smaller scaffold. If you are somebody who's in your 40s or late 40s and above, and you lose weight, you are going to be a candidate for a facelift in addition to a fat transfer. But if you're younger and you just lose the weight, whether it's through Ozempic, etc., all you would potentially need is a fat transfer or a volume augmentation to get you back to where you need to be. We don't want to create an impression that anyone who loses weight, regardless of age, needs to get a facelift. This is an important distinction because just because you lose the weight when you're younger doesn't mean you're a candidate for a facelift. Now, when it comes to weight loss, whether it's induced through GLP-1s or just, diet and exercise related, really at the end of the day, it's not to say that just because you have laxity that you should, in fact, go get a facelift. It's how you feel about that laxity. You have to have a certain level of mental preoccupation with the fact that the face doesn't match up with the way you envision yourself. In other words, they don't look as young as they feel. That's a perfect candidate for a facelift. So there's some really important safety measures and protocols that are absolutely necessary for anyone who is using GLP-1s to lose weight and is considering a facelift. So number 1, you need a fat transfer. A facelift without a fat transfer in somebody who's lost a lot of weight is gonna be a dissatisfying outcome because you're still gonna look gaunt, you're still gonna look tired. But the caveat is you actually need fat on your body to be able to get a fat transfer. I mean, there are situations where somebody has lost so much weight, comes in so lean that we're unable to harvest the fat for the facial fat transfer. So what I do in those cases is I ask my patients to go out and regain 5 to 15 pounds of weight so that I have a spot on their body to be able to take it. So I may ask you to actually gain a little bit of weight if you come in too thin. So keep that in mind. Warning number 2, you must stop GLP-1s a minimum of 2 weeks, ideally 4 weeks before and after surgery. Now, this is a major safety issue. So gastric emptying is the underlying problem. And since most facelifts are done under general anesthesia, now keep in mind, in our practice, the vertical restore is done under local with IV sedation. And that is why I say 2 weeks, because it's not as important as somebody who's undergoing general. But when the stomach doesn't clear and empty as quickly, you are at a higher risk for aspirating any of the contents that are in the stomach. Really, really serious complications that could even lead to death. And I think a safe zone is around 4 weeks ahead of surgery for you to stop these things. After surgery, we want you off of them. Now, it's not obviously not an issue with gastric emptying, but these medicines do sometimes have some effect on immune function, etc. So 2 to 4 weeks after surgery is a good period of time to let your body heal, get to where it needs to be, decrease your risk of infection, etc. So think about it as basically you're off of it for about a month to 2 months, straddling the surgery time. Warning number 3, you must prioritize your nutrition. Surgery is hard on the body. It requires a significant amount of nutrients and energy to heal the trauma that comes through surgery. Now, it doesn't matter what type of surgery you're having done. And remember, at the end of the day, these suppress the appetite to a certain level. And since you don't feel like eating, you're not getting a wide range of nutrients and vitamins and minerals and protein and all these other things. Then when you have the surgery, your body's unable to handle the healing load and the demand that it takes to recover from the surgery so that you can heal in the best possible way. I break down all the essential foods that you need for skin health and nutrition and healing in my last week's video, so make sure you check that out and recognize that you can apply those to pre-surgical dietary optimization. So that leads us to the 15-pound rule. So you've lost the weight, you've undergone the vertical restore or a facelift, you've got these beautiful results. How do you protect that investment? The magic number is 15 pounds. After a facelift and a fat transfer, you don't want to gain and you don't want to lose 15 pounds. You want to live right in between those two levels. If you gain more than 15 pounds, there's a potential that your face will start to look heavier. Now, heaviness in the jawline, heaviness in the submental area, all these things could come back to some degree as those fat pads begin to expand again. If you gain a lot of weight, you could even put the skin back on stretch, which is not a great thing after you've got done removing it and tightening it as much as possible. So why shouldn't you lose more than 15 pounds? Losing 15 plus pounds potentially will make you look a little bit more gaunt again, and it'll give you that hollowness to come back in certain areas. Now, it's not the end of the world if this occurs, but if it does, you might be feeling like you need a bit more volume than you just had done. So once you get a facelift or a vertical restore, you want to try to stay put in a stable zone. What oftentimes people will do is they'll have an extreme weight loss, then go get their surgery and then gain a bunch of weight back. Don't go for extremes. If you lose 50, 60 pounds, but you really don't think that it's possible for you to maintain 50, 60, you don't want to go in and get a facelift the second you touch, 50, 60 pounds, and then shortly after come back up and gain another 20. So the bottom line is you want to arrive at a weight that you can live with at the time you get the surgery done. That's the rule of thumb. If you're considering getting a facelift or vertical restore done as part of your overall sort of looking as young as you feel, get your body in mind and face back in shape, the skin is equally as important as the shape of the face. I developed the Karam MD trifecta for anyone and everyone. And I've seen some skincare products that have come out targeting people who are on GLP-1s. Really, there's no difference in the biochemistry of the skin of somebody who's on GLP-1s. Collagen loss is a ubiquitous normal process of skin aging. So getting to the root of that problem is really where skincare, active skincare should exist. That's where products like retinols, vitamin C, niacinamide, peptides, etc. need to be part of everyone's skin routine, whether you're on GLP-1 or not. So if you want to learn a little bit more about this, make sure you check out KaramMDSkin.com, and you'll see tons and tons of reviews from people who are currently using it on a daily basis. But again, skin and shape is how you address facial aging, period. First of all, be very proud of yourself and your commitment to lose the weight. That is no small feat. It does wonders for your health and your physiology. And at this point, wanting to get a facelift is the cherry on top, and there's literally nothing wrong with that. Looking as young as you feel is a very normal and human part of all of us. But if you're gonna go that route, make sure you understand the preoperative care, the postoperative care, the need to stay within 15 pounds, etc., to get the most out of your facelift results. And third, give yourself the best opportunity to heal and also to get the most out of your outcome. Excellent nutrition, good lifestyle, great skincare, all of these things are going to give you durability and joy over the long run and really become an important part of preservation and maintenance of your results. So those are the things that I think are essential for you to understand and know, whether you're having a facelift or a vertical restore, and making sure that you have great success with your GLP-1 weight loss journey. And for those of you who haven't already, make sure you sign up to the Karam MD Journal, where you can take a deeper dive into subjects like this and many, many other skin and anti-aging related topics. And if you're somebody who's experienced Ozempic face and wondering what to do and has had your own journey, I hope you feel comfortable sharing it in the comments below. And as always, any questions that you have, drop them in the comments below. Thanks for watching. Until next time, Dr. Amir Karam.